And so those are the two big takeaways that I had, especially around the timeline, just the thinking behind it. Okay, this is the way it's going to be, not for a few more weeks, but until the summer most likely. And then even after that, we've got to prepare for smaller waves of this and do things that prevent that.
And you're quite right. One of the things they highlighted was that this is really regional epidemics across the country based on how different provinces have responded, things like spring break, the amount of testing they are doing. I will turn to you, Catherine. There was a smidge of good news, because I'll take any smidge of good news in days like this, where Dr. Tam said that the curve nationally is beginning to bend a little bit. That's as far as she would go. Not that we are anywhere near anything, but there is a little bit of encouragement there.
Well, Rosie, I'll pick that up and say, I mean, she did make the point that there was not a particular, we couldn't talk about a national peak, right? Because this is somewhat of a, well, not somewhat, it is a regionalized picture, right? And they also talked at the beginning of that slideshow about the fact that we're seeing the 4 largest provinces really being hit. And talked briefly as well about the significance of this outbreak in long-term care facilities, which I think is clearly going to be a big part of this story going forward. I also wanted to talk a little bit about responsibility vis-a-vis these numbers. If we stop for a minute and look at the possible death projections in the scenarios that we focused the most on today. So 11,000 deaths versus 22,000 deaths. It's a lot of numbers today, not only these projections, but the job numbers. We said it about jobs, and we certainly need to say it about this. That's a really, it's such a significant, such a meaningful range. If we stop for even a second to consider the amount of human suffering between one of those numbers and the other. And they talked a little bit about the measures that need to stay in place in order to ensure a best case scenario. So stronger epidemic control models include a high degree of physical distancing. So that is the responsibility of individual Canadians, something we can expect to hear the Prime Minister talk about when he comes out today, what we can do, physical distancing, proper etiquette and whatnot, but also the responsibility on our public health officials right now. In order to achieve that best case scenario, we need, they say, a high proportion of cases identified and isolated, a high proportion of contacts traced and quarantined. So Canadians really need to do their part. We're clearly going to need to do our part for some time, is the message from health officials. And this, of course, going to be a key weekend when so many of us would like to be with our families, and public health officials saying you're going to have to do that virtually, but also the massive responsibility on officials in the healthcare system to step up testing, certainly in some jurisdictions, and to really track this virus as best they can. That is the way that we are going to save, I mean, we really are talking about, in this case, certainly, even in the best case scenario, a range of thousands and thousands of lives.
Yeah, good to remember that these are individuals we're talking about, not just projections. Appreciate that, Catherine. As we stand by and wait for the Prime Minister, it appears to be snowing in the nation's capital, so just full of good news over here. Let me turn to Dr. Zulfikar Bhutta. He's a researcher and professor of epidemiology at the University of Toronto, also chair of a number of organizations dedicated to health policy. Good to see you, Doctor.
Good to be with you this morning.
I'm obviously waiting for the Prime Minister, so if I cut you off at any point, it's only for him. Tell me, you were listening in to the brief there from our federal public health officials. How did you take in the information? Did you view it as helpful, or would you characterize it for me?
So I thought it was very helpful, and it's about time that the federal government came out with some figures that one could relate to, because we've had the provincial models and projections over the last several days and weeks. I thought the gist of the message was positive, that Canadians needed to continue to do what they were doing, because there was early indication that we were perhaps successful in bending the curve a little bit. My overall sense was that there was an emphasis on the positive. And the most optimistic scenarios of, being between 1% and 5% infected rates. But the reality, as time goes on and as people get tired of social distancing, as economic pressures pile up, would be that we probably need to include within that range the possibility that there may be slackening in some places because of economic necessity, and also the fact that people get tired and of sitting at home. So I think it is timely to have this model out, but it's only one model. And the important thing right now is that, particularly in dynamic models, we need to feed this with ongoing information, and particularly engaging our academic sector and researchers in building the model based on the ground realities as they build up. So overall, I welcome this move. I think it's very important now for us to have something to relate to and to feed information into it as the epidemic evolves and as our response evolves. And obviously, over time, there's food for thought.
Yeah, it does sound as though this is not the last briefing. That's how I took it as well. So hopefully we will continue to get information. You're quite right, Doctor, as more is fed into that dynamic modeling. The fact that Dr. Nuge suggested that first wave will last until summer, whatever that means, and we keep these public health measures in place at least until then. Would you agree with that assessment? And how do you get people to stay on this course until summer?
So that wave that Nude alluded to is dependent upon very high level of compliance. So if you have the high level of compliance and we stay within that 1 to 5% range, we will probably see the end of it by the end of the summer and begin to see some degree of graduated return to normal. But if things were to change, if we were to get pockets of outbreaks, if in our neighboring states, and I'm worried about New York, which is right at our borders, if the wildfire spreads and if you begin to get pockets which are not reflective of just that percentage, potentially higher, then we should be prepared to adjust. So I thought that the end of summer was a bit optimistic, that my sense is that the overall measures would need to go into the fall. And that we should be prepared for that eventuality based on these dynamic models that we then adjust as real data begins to come in.
Yeah, that's a good point. Certainly the border restrictions, you can see how they may have to stay in place longer than sort of domestic measures. What do you think, though, of the fact that there are provinces, as Vashi talked about there, who are doing better? BC is performing well, has tested more. Alberta's seen some hopeful signs. Is there any world in which restrictions could slacken in parts of the country and not others? And how would that actually affect the potential spread of the virus if we did that?
So I think travel controls and ensuring that reinfections or imported infections, as is being seen in many other parts of the world, notably China is dealing with one right now, those would need to stay in place. And particularly as economic activities return and domestic travel within the country goes back to normal, I think some measures in terms of ensuring that we keep our eye on potential outbreaks, on differences in epidemiology between provinces, those would have to feed into the public health response. But the bottom line is that there are differences between the way BC did and other provinces did. And they were, number one, ahead of the curve. They were led by science from the very outset. I think public communication in terms of response in British Columbia was ideal in many ways, sharing of information. And also they tested much more. So really speaking, they were, in terms of response, a model for many other provinces to follow. And we're still trying to play catch up in many ways in getting our testing and therefore our denominators right in terms of getting a sense of what is the total population infected and by default, total population susceptible.
Last question to you, Doctor, just about Ontario, because we have heard of there's not enough testing, frankly, and the Premier made that very clear yesterday, that was not acceptable, that we should be testing, close to 13,000, 15,000 people a day. How concerned are you that Ontario in particular does not have an accurate picture of what is happening with this virus in this province?
So, very concerned. And many of my academic colleagues have made their points of view well known in terms of sharing of data as well. So I think there needs to be more public sharing of information, particularly with the research bodies, academics, people who do modeling for their academic life. Also, importantly, we need to know where the hotspots are. Where are the data gaps where we have very little information, particularly in Ontario? And where is it that we are not even able to ascribe appropriate causes of death? So as you know, in many other countries, there's concern that many of the COVID-related deaths, particularly in nursing homes and in the elderly, are not being categorized as COVID-related deaths because they weren't tested. And I think we need to have a very close look at this because clearly we were not ahead of the curve. We were far behind it insofar as the nursing homes mortality and the tragedy is concerned, nearly half of all deaths in Canada are amongst occupants of those kind of facilities. So some redress needs to be made immediately in terms of ensuring that these high pockets of susceptible populations can be addressed both in terms of the frequency, the repetition, and also the criteria for testing population.
Okay, Dr. Bhuta, thank you so much for your expertise on this. I do appreciate you putting it into perspective for us. Thank you, sir. Stay well. Dr. Bhuta is a professor of epidemiology at the University of Toronto. We are standing by to bring you the Prime Minister's daily briefing from his home, Rideau Cottage, where it is apparently snowing. So I know it's snowing in many places across the country, Alberta, Manitoba, and now apparently here as well, which actually might help people stay inside, because who wants to go out in that case? We will, of course, hear from the Prime Minister on the models and the projections that, you know, there was some pressure to get more from the federal government on that front, and we did get that first picture today. But there will also be questions, obviously, on the state of the economy, knowing that 1 million Canadians lost their jobs in March, data really driven by the third week of March, but we also know that that is actually a picture of the past, that we have now more than 5 million Canadians who have registered for the economic relief package benefit, and so there'll be far more Canadians who have lost their jobs and will lose their jobs still as the economy comes really to a standstill in order to put into effect these public health measures. Vashi, I'll bring you back in for that. I mean, it is... it's a lot of people, and I know that there are many more, and all of these people have reached out. So the people that are being asked to, oh, there's the Prime Minister. So I will be quiet and let him talk, and I'll come back to you both after this. Here he is.
Bonjour tout le monde.
Good morning, everyone.
I want to start off today by talking about the job report we just received for March. As stark as those numbers are, they aren't a surprise for a lot of Canadians. Each one represents a different story. A worker who's been laid off, a family that's having to hunker down, a community that's anxious about today and tomorrow. We've all seen the impact of COVID-19. We all knew this was going to be a tough time and that countries around the world are in a similar situation. But that's no comfort if you're out of a job, if you're having difficulty making ends meet. You need real support. So we're doing our best to help you bridge to better times. On Monday, we launched the Canada Emergency Response Benefit. More than 4.5 million claims have been processed, which means people are already receiving their $2,000 for this month. We're also working on legislation to bring in a wage subsidy to help employers keep people on the payroll while working on new loans for business owners. We will keep expanding our 3-point economic plan to protect jobs, support business owners, and get everyone the help they need. Things will get better, and once they do, you can be sure that our country will come roaring back. As a country, we've gotten through tough times before. We've stood together, united and strong. On Vimy Ridge, more than 100 years ago today, thousands of Canadians gave their lives so that our country would know peace.
Today, we remember those who fell at Vimy more than 100 years ago today. We remember the sacrifices that they made for our country. They fought to defend values that are dear to us, such as equality and peace, for values that still define our country.
Historians have noted, reflecting on Vimy, it was a moment ordinary people did extraordinary things. Fathers and sons, brothers and friends, their sacrifice and courage defined what it is and what it meant to be a Canadian. And their legacy lives on in the women and men who continue to step up and serve us in uniform, in our nurses and doctors who put themselves in harm's way for us all to stay healthy, and in everyone who steps up and asks what they can do for their fellow Canadians. That's what makes Canada strong. And that will be our path forward, no matter what tomorrow may bring. Right now, the future can seem even more uncertain than normal. If you've lost your job, if you're worried about an elderly parent, you probably want to know what to expect. Earlier today, we released our modeling on how we think this pandemic might unfold. The modeling shows that COVID-19 arrived in Canada later than in other countries. So we're in an earlier stage of the outbreak. That means we have the chance to determine what our country looks like in the weeks and months to come. Our healthcare systems across the country are coping for the time being. But we're at a fork in the road between the best and the worst possible outcomes. The best possible outcome is no easy path for any of us. The initial peak, the top of the curve, may be in late spring with the end of the first wave in the summer. As Dr. Tam explained, there will likely be smaller outbreaks for a number of months after that. This will be the new normal until a vaccine is developed. But as we saw, that is so much better than we could face, all of us, if we do not rise to the challenge of this generation. The path we take is up to us. It depends on what each of us does right now. It will take months of continued, determined effort. We'll need to keep practicing physical distancing, staying home, and washing our hands. It will help. It will help get the numbers that Dr. Tam was talking about, between 4,000 and 44,000 deaths, as low as possible.
I know that Dr. Tam and the entire team at the Public Health Agency have worked very hard to prepare those projections and to ensure us that all the information is up to date. We are in constant communication with the provinces and territories to get their latest data. Earlier today, we released our projections. The models show that COVID-19 arrived in Canada later than in other countries. Therefore, we are still in the early stages of this epidemic. That means that our actions are even more important in terms of determining what our country will look like in the weeks and the months to come. For the time being, our healthcare system is holding strong, but we are at a crossroads. The path that will take us to a better result will not be easy. We could reach the peak at the end of the spring, and the first wave could end in the summer. But as Dr. Tam explained, we will probably see other outbreaks, smaller outbreaks, for a certain number of months. It is and will be our new reality until we find a vaccine. But as we saw this morning, it's a better scenario than what could happen if we refuse to act. The path we take will depend entirely on all of us. We will have to be disciplined in the next few months. We will have to continue to stay home and continue to wash our hands. That's how we can avoid the thousands of deaths and reduce the number of cases.
I know it's tough to stay home, especially as the weather gets nicer. If you have kids, it's even tougher. But to get them back outside and running around the playground and park as soon as possible, you need to keep them inside for a little longer. This will work, and we'll be with you every step of the way. Just this week, we received millions more masks to keep our frontline workers safe, and we have contracts to get more ventilators. We're helping industry mobilize, like the entrepreneur from Vars, Ontario, who's creating reusable visors for hospitals across the province. And we've continued to support Canadian researchers working on a vaccine. We're pulling out all the stops to beat this virus and help you get through this time. On doit tous faire notre part.
We must all do our part, governments, businesses, and citizens. So continue to stay home. Continue to do your groceries once a week only, or even less often than that. And if you must go out, do keep a 2-meter distance between you and other people. That is how we can protect vulnerable people. That is how we can protect our seniors. That is how we will save lives. And that is how we can help our nurses and physicians who are doing extraordinary work every day. I know it's not easy, but it won't last forever. At some point, we will be able to go back and watch a film or go to parks. But for now, everyone must do their part, now and for the coming weeks.
Over 100 years ago today, Canadians showed what metal we are made of. I know each of us will rise to be worthy of the legacy of the heroes that built this country. We can do this together. Merci tout le monde.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Merci. Thank you. La première question est de Michel Lamarche, TVA Nouvelles. À vous.
TVA Nouvelles.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to hear you comment on these waves that Dr. Tam referred to earlier. I'd like to know if, seeing that this could continue into December with more outbreaks, you are prepared to renew all of your aid programs until then. We will be there to help Canadians as long as they need help. But we all know that the time this will take depends very much on what we're doing. Canadians have to continue to stay home. On whether they do that, or on whether we continue aggressive testing, or on whether we continue to do aggressive contact tracing. If we do that, we'll be able to meet those minimal projections and come through this first wave. Yes, there will be other waves until there's a vaccine, but those waves will be much easier to manage with the knowledge and the equipment we have now, and through Canadians' new habits and their ability to keep themselves safe.
We recognize that what we are doing today is making a difference, and we are hopeful that we're going to be able to get through this in the shortest amount of time. But no matter how long it takes, we will be there to support Canadians in order to get through this. We know, though, that in order for it to last as short as it can and to harm as few Canadians as possible, we need to keep doing what we are doing. That is what leads us to the best scenario. And once we're through this first wave, as we look to the resurgences that will happen over the coming months until we discover a vaccine, now, we will be much better equipped, both with aggressive testing strategies that we're developing right now, with aggressive contact tracing, and with Canadians who know what to do when they have to socially distance, to stay home where and when necessary in the coming months.
Suivi.
Follow-up?
On a bien compris, Monsieur le Premier
Yes,
ministre,
we
qu'aider les
understand,
Canadiens à ce
Mr. Trudeau,
moment-ci, ça
that
n'a pas de
helping
prix.
Canadians has no price. But I'd like to know whether there's an assessment of the cost that's been done over the next few months, and can we afford to spend hundreds of millions of dollars more, possibly until December? That is one of the reasons why it is so important to come through this first wave as quickly as possible. That is why that in the coming weeks, people will have to stay home and limit their movements as much as possible. When we come through this first wave, as we saw in the modeling, we will be able to open up the economy to a certain extent and set aside some of those restrictions as we manage the new reality so that economic activity can start up again. Of course, everything depends on what we're doing now. However long this may last, we will be there to help each other because that's what we do as Canadians. And we know that if we want to get back to a normal life at some point, people need the necessary support to come through this.
Thank you. Merci. The next question, Mia Rabson, the Canadian Press. Line open.
Good morning. I'm just wondering, given the new projections today, do you think that we're going to have stronger measures necessary to keep people at home? Do you think people are listening? And what are those measures that you think we might need to add?
We have seen that the measures that have been taken seriously by Canadians right across the country. People are staying home. People are choosing to go out only for necessities. They are working from home as much as possible. And these are the measures we know are going to keep us on the right path. Are there things we can do to strengthen and improve? Sure, and we'll keep looking at those. But the big things that we're going to be able to improve in the coming weeks is stronger and more sophisticated and aggressive testing protocols, because every day we get better at that. And continuing to develop tools for better contact tracing. We know that those things on top of the social distancing that we're doing right now have the best impact on keeping this curve as short and as low as possible.
Follow-up?
And I'm also wondering if there are going to be multiple waves of this, if we aren't going to be able to sort of get out of this until we find a vaccine, which we're told is 12 to 18 months away at best. Do you envision that we're going to have multiple waves of shutdowns, lockdowns, closures of the economy? And how can we handle those kinds of constant shutdowns?
I think even after we're through this first wave, we will need to remain vigilant and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this. And as you say, that could be a very long way off. But once we get through this first wave, we will have developed both tools and habits that will allow us to be much more resilient and resistant to further outbreaks and spreads that will be able to be kept localized, that will be able to fight against and protect our most vulnerable from over the coming months. It will require continued actions in different places and quick responses. But part of getting through this wave in a rapid way will be because we are developing the tools that will also help us when those wavelets come forward in the coming years, in the coming months. Okay. What
we are seeing is that even if we come through the current wave, we will not be able to return to normality the way it was before until there's a vaccine. And that could take a year or a year and a half. We don't really know, but we hope it'll come sooner. But our ability as a society and the ability of our system to respond to these small waves and these small challenges that we'll face with these more localized outbreaks with better tools will allow us to start up economic activity again, but we will have to remain vigilant in the year to come.
Thank you. Merci. The next question, Maura Forrest, Politico. Line open.
Yes, thank you, Prime Minister. Today, obviously, there's been a lot of grim announcements that people have had to take in, both in terms of job numbers and in terms of these projections. They're getting this information as they're heading into a holiday weekend when they're being asked not to celebrate with their families. I'm just wondering how you think Canadians should react to this today.
I think obviously this is difficult news. This is news that reflects, particularly in the job numbers, a reality that millions of Canadians have been feeling over the past weeks. That the real impact on not just our economy, but on the lives of Canadians, of workers, of families, of communities, is significant and real. But what we're also seeing in numbers from different parts of the country is that there is a light at the end of this tunnel. That if we keep doing the things that we're doing the way we're doing, as we've seen in other countries, we are able to minimize the level of the impact of this wave of COVID-19. We are unfortunately going to continue to lose people across this country in the coming weeks. But we also know that there are things that we can continue to do to make sure we get through this first wave as quickly and as low impactly as possible. That's why as we gather with the immediate family members that we're sharing a home with right now, as we FaceTime to our loved ones and reflect through this Easter weekend, we need to know that we will continue, we can continue to do what is necessary for the coming weeks and months to get through this first wave in the right way so we can get back to being there for each other in the coming year.
Follow-up?
Yes, thank you. Dr. New this morning said he was going to be celebrating this weekend virtually with his family. How will you be celebrating?
I'm hoping to be able to see my family this weekend. Of course, the priority is ensuring that we're getting the legislation passed. Conversations are still ongoing with members of the opposition parties. We know that we need to pass this legislation to get the help to people that is needed. That's why while we continue discussions around democratic processes and defending our institutions, which will be ongoing, which is really important to me and to all of us, we need to move forward on getting this legislation moving through the House so we can get the help out to Canadians, and that is my focus this weekend.
En français.
Okay. I
hope to be able to spend some time with my family this weekend, but the reality is that our priority is to get this legislation passed so that we can help even more Canadians and get that aid out to workers and businesses. And that's why we are in discussions with the opposition parties. Of course, we need to ensure that our democracy continues to work and that our strong institutions are there for us in these difficult times. But we must absolutely bring back the House of Commons to pass this bill so that we can help people. And I do hope that the opposition parties will agree with me in saying that Canadians cannot wait.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Good morning, Mr. Trudeau. With respect to that bill, we understand that the Conservatives are saying that Parliament will have to meet in person, in reduced numbers. That is the condition for their agreeing. Now, why is this their condition? First of all, we're very open and we're prepared to recall Parliament to pass important legislation and do the job that people expect us to do as a government and as a Parliament. But we also know that we must follow the recommendations of healthcare experts and not assemble people if it's not absolutely necessary. There are virtual means available, and even if we meet in reduced numbers, there are security officials and other people who will be there and must be there to help us. But we want to minimize any impact. And of course, we want to continue to seek ways to work together and ensure that we can keep our strong democracy and our strong institutions working. We're very open to that, but I think we're in a time now where we should not be preventing the passage of important legislation just because you want to keep talking. So those discussions will have to continue. And with respect, I'll just answer in English.
It's extremely important that we do have strong democratic institutions that continue to function to serve Canadians, to get the help needed to Canadians, and provide that input from voices across the country on the impact that things are having in their community. That is essential, and we're going to continue to talk with opposition parties about how we can make sure that our institutions and our parliament continues to function. It is something to remember that when we do gather in smaller numbers, first of all, it still requires a significant number of support staff to come into work, to be there while Parliament is functioning, and that puts them at risk as well. But it's also something that doesn't allow for members of Parliament who live in further off parts of the countries to be weighing in and make sure that their communities are being heard. That's why we are so interested in looking for virtual ways of gathering the House, and we're going to continue to work on that. But it's, I think, really important that parliamentarians get together to make sure that the work of getting the help to Canadians happens, and happens quickly, while these continued conversations about furthering our democracy in this moment of crisis continue. It's not the time to further delay getting help to Canadians.
And a sub-question, Mr. Scheer is saying that none of that is a problem because in any case, the infrastructure to get that subsidy out there is not ready, and it couldn't be given to them right away anyway. So do you consider that the Conservatives are responsible, or are you responsible because you're unwilling to make a compromise? I'm a little disconcerted by that comment if Mr. Scheer actually said that, because we believe that debate and discussions in the House of Commons are often a place where we see the impact and we can adjust our legislation to get even better outcomes. I don't think any party, even a party that's in government, knows exactly everything that's going on in every circumstance. And the federal government has an important role, and the opposition also has an important role in improving legislation, even in the midst of an emergency. So for me, recalling Parliament is not just getting them to, give their stamp of approval. No, it's because we have an opportunity to debate and do the right thing for Canadians. And if that is what Mr. Scheer said, I'm a little disappointed in his lack of understanding of the importance of informed debate in Parliament when looking at legislation.
If indeed Mr. Scheer suggested that the debate and discussions had by parliamentarians around a given piece of legislation don't really have an impact, I choose to disagree. I think it's really important that we hear voices from every corner of the country on the potential impacts or potential improvements to the bill we're putting forward. I think that's how Parliament is supposed to work, and that's how Canadians consider that Parliament is supposed to work. So I very much look forward to the debate on our wage subsidy to see how it's going to impact, and hear from every corner of the country as much as we can on how we can make sure that it's doing the right things for Canadians. Parliament matters. The debate that happens in Parliament matters, and you can't just shrug it off like a rubber stamp that doesn't matter, because I know how deeply it matters that we have proper and robust debate on this.
David Thurton, CBC News. Prime Minister, documents show that the government has been preparing for a pandemic for over a decade, since the outbreak of SARS. But we're seeing now that, it seems like the government has been caught off guard, and Canadians are paying up the price for that. What went wrong in your planning?
I think we've seen countries around the world caught off guard by the nature of this epidemic. The challenges that we've faced in terms of getting Canadians protected are echoed in challenges faced around the world, and some countries are handling it better than others. I think Canada has done a good job of keeping on a path that is going to minimize as much as possible the reality we're in right now, and that's why we need to continue to do the things that we're doing, staying home, contact tracing, aggressive testing, and why we need to continue to listen to experts on next things we can do or other things we need to do to ensure that we're having the minimal possible impact on Canadians. And of course, there'll be lots of lessons learned from this, as there were lessons learned from SARS, and we're going to learn them and bring them into play.
What went wrong in the government's planning?
I think we all know that this was a situation that we're adjusting as best we can to. We took the advice of experts. We moved forward in significant ways. As we look back at the end of this, I'm sure people will say, oh, you could have done this a few days before, or maybe you did this one too quickly and you could have taken a few more days to reflect on it. Every step of the way, we make the best decisions we can, given the information we have. And if it's not exactly right, we fix it and we try and get it better as we move forward. I think that's what Canadians expect.
Hi, Prime Minister. Molly Thomas, CTV National News. Your government says they're negotiating with the opposition right now. Can you help Canadians understand what is the holdup to recalling Parliament? This wage subsidy is sitting on the table. There are businesses we're talking to on the brink of bankruptcy here. What is the holdup right now?
My understanding is that the legislation itself is largely seen as the right solution by other parties. They may have little tweaks and improvements to make, and we look forward to working with them on suggestions or amendments that they have. But there seems to be a sense from the official opposition that this is a moment to define or determine how Parliament will function in the coming weeks, and they are negotiating around the structures. We've said we're of course happy to have these conversations. We've put forward some proposals around things that we think could work to both minimize the risk to Canadians while moving towards a virtual Parliament and ensuring the debate and accountability that is so important in our democracy. And we just hope that the official opposition will choose to realize that we need to pass this legislation quickly to get the help out to Canadians as quickly as possible. Okay.
My understanding is that the bill per se has the general support of the opposition parties. They recognize it is important and they may want to propose certain amendments, and we're certainly open to that. But the official opposition is insisting that this is a time to determine what Parliament should look like in the coming weeks and bringing in very strong measures. And of course, we're open to talking about this, but we believe this should be done in parallel with the normal legislative process because the bill needs to pass as quickly as possible in order to help Canadians as quickly as possible.
About Canada having fiscal firepower. The government was planning for 4 months of uncertainty here, at least in emergency funding. How long of a financial rope do we have here, and should we be rationing that emergency funding and at all, knowing that we're in for a year here of self-isolation on and off?
We had made the decision early on that we needed to be aggressive and broad in getting help out to Canadians, and that's what we did with the Canada Emergency Response Benefit and the wage subsidy. And we've moved very, very quickly, and we are continuing to fill gaps and look at areas where we can do more to help Canadians. We will continue to do that. But we knew that our best chance of rebounding from this strongly and getting back to the extraordinarily successful country and economy that we've had, that we've built over so many generations, is to ensure that Canadians are supported through this, however long it takes. Now, we are extremely hopeful that we will be able to begin to restore a certain measure of economic activity in the coming months after this first wave is passed. But we will make sure that every step of the way we're giving Canadians the support they need to be able to keep themselves safe, to do what is necessary to keep us all safe, and to ensure that as we get going again, Canada continues to be successful for all Canadians.
En français.
Okay. Nous reconnaissons
We recognize that we had to bring in broad measures quickly to help as many people as possible. And that's what we did with the Canada Emergency Response Benefit and the wage subsidy. And we will continue to do whatever is necessary as long as it is necessary. We hope it'll only take a few months for this first wave, and that will allow us to start getting things back on track economically, getting people back to work with additional measures so that we can continue to succeed as a country. But whatever time it takes, we will always be there to support the Canadians who need help. Radio-Canada, you say it may take a year or a year and a half before we return to normal. Does that mean a year or a year and a half before kids go back to school or people go back to work or we can go to a park with our family or attend concerts? Is that what you're telling us? Is that the normal you're referring to? What I'm saying is that until there is a vaccine available, the reality of COVID-19 will still be with us. So for the months that will take, and there are some estimates that say 6 or 8 months, some say a year or a year and a half, we will have to be vigilant. We will have to have measures followed as part of our normal life, and at the same time we will have to have measures ready to introduce if there's a resurgence of the virus in certain areas of the country or under certain conditions. But once we've come through that first wave, we want to be able to allow some economic activity to start up again, and that's why there will be a graduated return to normal economic activity compared to now. But I think it's important that people understand we'll have to be vigilant for a year or a year and a half. There are things that we will not be able to do, but there will be a lot more things that we will be able to do. And that is if and only if we come through the next few weeks and the next few months properly. And that's why we are going to have to remain in this current phase for some time. Do you think that the level of tolerance of Canadians is where exactly? How long can they stay in this kind of confinement? There are some people who are isolated, who don't have any doctors. Some people are not there for them. The government is not there to help them. What do you say to those communities that need help now? Well, we have seen some difficult things happen in the past. When we think of generations of Canadians who have made sacrifices in the major wars, including Vimy 100 years ago. But there are Canadians right across the country that have made sacrifices for many years in order to build the country that we have today. Now, I know that it's difficult, what we're doing now and what we're experiencing, and that's why the government is there to help vulnerable Canadians, to help people who are losing their jobs, to help people that need to support their families, and particularly to help and protect our frontline workers, whether it's in the healthcare system or our grocery stores. These people ensure that we'll be able to come through this and meet this challenge the right way. So we will continue to be there for each other, we will continue to lean on each other, and we will come through this because we're strong as Canadians and as a country. Now, with respect to the Indigenous people, we're very concerned, and we have been very concerned from the outset about the vulnerability of those communities, and that's why we have made investments. We made investments right away to improve the resilience of those communities. But we know there's still a lot to be done, and there have been a few cases in certain communities, which is very much a concern, and we're working very seriously on this.
President Trump is looking at tariffs on imported oil aimed at getting Saudi Arabia and Russia to reduce the flood of crude oil swamping the market. Is Canada looking at the same to support our oil and gas industry? And if not, what is the government going to do to support the industry?
I can tell you that our Minister of Natural Resources, Minister O'Regan, is closely coordinating with his counterpart, the Secretary of Energy in the United States. We recognize that the North American market and oil production sector needs to stand together on this, and we're working very closely with our counterparts and our NAFTA partners to ensure that we have a strong and united front in dealing with this global situation.
Prime Minister, Sean Silkoff from the Globe and Mail. My colleagues today wrote about the fact that Ottawa had a playbook for the pandemic 14 years ago. It was co-authored by Dr. Tam, and subsequent audits flagged problems with Canada's emergency stockpile of medical equipment. You said just a few moments ago that you were caught off guard, but given all the pandemic preparedness done here in Ottawa going back to 2006, and how some of the plans, like having enough medical supplies in our stockpile, have come up short, what will your government do to fix that going forward?
Well, I think we've already seen, and we spoke about a number of times in the early days of this pandemic, how there were significant lessons we learned from that SARS epidemic. There were things that were done or were not done in 2003 that led to significant changes in our approach on public health. And Canada was better positioned than a number of countries around the world to respond to this pandemic because we had and learned from the experience of SARS. Similarly, as we go through this time, we will learn more things about how to be even better prepared next time, if this ever happens again, as it is likely that it will in the coming decades. We need to make sure that we have the tools necessary to keep Canadians safe, and that is something that keeps evolving every single day. We will listen to science, we will share the best recommendations with Canadians, we will lean on each other, and we will get through this together. It's what we do as a country. Merci.
Merci beaucoup. C'est ce qui m'a fait à la conférence de presse d'aujourd'hui.
Bonne journée.
All right, that is the Prime Minister of Canada giving his daily COVID-19 briefing and returning to his home. Probably the clearest and starkest message we have heard from the Prime Minister to date about how long we are going to be in this and how long we are all going to have to contend with these strict public health measures. The Prime Minister saying that this is, quote, the new normal until there is a vaccine, suggesting as well that there will be some of these measures that will need to be in place for many, many months. Let's bring in Vashi Kapelas and Catherine Cullen. So a tough message probably for everybody to hear, that this is not, even if we get past the first wave this summer, this is not something that is going to end quickly or soon or easily. And listen, I didn't love hearing that either, but it is important that people recognize the time length here. It is the question that the most Canadians had. How long is this going to go? And the Prime Minister was quite blunt today, Vashi, really for the first time.
Yeah, it almost felt like ripping the Band-Aid off, right? Like, I think you're right to say that it doesn't feel good to hear what we heard today, but it also builds very much on what we heard from Dr. Theresa Tam and Dr. Howard Nuge when they were presenting the modeling and the forecasting. There is data to sort of underscore the point that by the summer, we may be able to say that the first wave, the most severe wave of this epidemic is over. But really, until there is a vaccine, the only way we can contend, and you've pointed this out often, Rosie, contend with this, the only way we can sort of fight back against the spread of this virus is to practice these physical distancing measures, to see businesses shut down, the economy slowed so much. I mean, that is really the only tool that we have at our disposal, and that was underscored by both the public health officials and the Prime Minister. I would point out just one thing that I noticed he said near the end of the press conference, and it was in French, but he did talk about the desire on his behalf and the federal government's behalf to lift some of the economic restrictions, right? And after that first wave. And that is something that we also heard from public health officials, just sort of this idea of, okay, once the first wave is over, if it does, in fact, end by the summer or sometime in the summer, what does that then mean for the economy or for the restrictions that have been placed on us? And it sounds like there is a desire on the part of the federal government to ease some of these restrictions, but again, that is going to depend, and this is what the public health officials kept saying, on the province that you live in and how the sort of epidemic is faring there, as well as the measures that they have in place to sort of contain the second wave or the third wave. And I'm talking now about testing or surveillance. So I think actually there are a lot of questions for both federal and provincial governments now about how they plan to tackle the sort of post-first wave period. What kinds of things will they employ in order to try and ease some of those restrictions? Because as your last guest pointed out, there is sort of an intersection here between the public health aspect of all of this and the economic. We're seeing the staggering, awful numbers of job losses just in March already. How long can people sustain the economic damage that has been inflicted on them, that this virus has inflicted on us? And at what point is it just too difficult to maintain the physical distancing measures that are so necessary in order to slow the spread of the virus? I think there are very valid questions now that we have all this information, as tough as it is to hear in front of us. Important questions for the governments going ahead on that.
Vashi and Catherine, thank you so much. Catherine, I'll talk to you in just a moment. But for now, I want to say goodbye to viewers on the CBC main network. If you'd like to continue watching our federal briefing, CBC News Network and CBC.ca. I'm Rosemary Barton. See you back here tomorrow. Hello again, I'm Rosemary Barton, live from Ottawa. Thanks for joining us on CBC News Network, streaming worldwide on the CBC News app and CBCNews.ca. Here are the headlines. We now have a first national picture at how this pandemic could unfold in this country. Canada's top doctor released predictions for the best and worst case scenarios on how many people could become infected in Canada, how many people could die from COVID-19. And we've also got a much better sense of how long these strict public health measures to stop the spread are likely to be in place. We'll also look at some other data today, employment numbers that the Prime Minister calls stark. More than 1 million Canadians losing their jobs just last month from the pandemic shutdowns. Let me go to my colleagues, Catherine Cullen and Vashi Kapelas. I'll start with you, Catherine, because I left off with Vashi. And Vashi was making a good point about sort of the pressure being put on the economy to loosen the public health measures, which is what is obviously suspended the state of the economy. But also, I think, given that the Prime Minister is now talking about a fairly long timeline, the new normal of living like this, you know, Canadians' resilience to sticking to those measures as well. It is, I know there's jokes about people, you know, it's not that hard to stay on your couch, but it is asking a lot of people to restrict their interactions with others.
That's right, yeah, and you rightly referenced that phrase, the new normal, which I think is going to be, for many people, the big takeaway from today when we look at the time span of this. I want to grab onto that idea Vashi was talking about, though, about the economic implications. Now, on the one hand, you heard the questions to the Prime Minister, how long can the Canadian government sustain this sort of financial support? What are you prepared to do? I think one colleague phrased it, you know, essentially, how much rope do you have? And he said, listen, we'll be there as long as we need to be there. Now, I think it's important, though, to consider a couple different aspects of this. Yes, there's the question of direct economic support that the government is trying to provide to Canadians who have lost their job because of COVID-19. But there are other effects as well in terms of businesses of all size. But of course, we think particularly of small and medium-sized businesses. It's one thing if this is just a few weeks. Some businesses may be able to sustain themselves, but the longer this goes on, the bigger the economic impact on that front, and the questions about what sorts of jobs will be available for people to come back to. You really got a sense, particularly in his opening remarks, that the Prime Minister was trying to be encouraging. You know, he said at one point in his opening remarks, when the economy comes roaring back. But it really was a very sobering message today, I think. You know, he talked about wavelets as well, the possibility of these smaller waves afterwards. And we want to juxtapose that with the message from public health officials earlier. Theresa Tam saying, listen, if we loosen measures too quickly, it could ignite a whole other problem. So this difficult balancing act that the government is trying to do on an economic front, on top of the sort of more personal morale questions. I think some of this is being asked, of course, because people know that they're going to get tired, if they aren't already, of staying in their homes. But, you know, the stakes are so incredibly high.
That's right. I was just going to say, I mean, the reason this is being said today, the reason the modeling was being put forward, the things the Prime Minister said, it is actually about saving lives and how many people's lives can be saved depending on the rate of infection. And we got some of those numbers today. If the rate of infection is 2.5%, which it is not now, there are still 11,000 Canadians who will die, and it'll put, as Dr. Tam said, an enormous amount of pressure on the healthcare system. I do think, as you say, Catherine, that the Prime Minister was trying to be encouraging for all of us to stick with this. And I will just say, because I've had a couple questions on Twitter just about the upcoming weekend, which is a celebration of Passover yesterday, Easter. I know Ramadan is to come. When public health officials say stay within your immediate family, they mean the people that you live with. They don't mean your aunts and uncles who live in other places, or your parents or your grandparents. They mean the home that you live in. Those are the people you can celebrate with. Nobody else, unless you FaceTime or Zoom or however you want to celebrate those things. But I think that's really important to remind people as we move forward. That is their best advice for us.
The example Dr. New gave, I think, is probably especially pertinent, right? Talking about his own children, who you might think of as your immediate family. He said he has children in Montreal, and he's only going to be speaking to them virtually.
That's right. I'm going to just go to Peter Armstrong, I think, if I can, and I'll come back to both of you as we await this federal briefing, because as we both, all three of us were talking about there, the state of the Canadian economy, obviously under an extreme strain, because it has essentially been put on pause until these public health measures can contain the pandemic. And Peter Armstrong, our senior business correspondent, joins us for some more analysis on that. So obviously, Peter, we knew the job numbers were not going to be good, but it's one thing to know it, it's another thing to actually see it.
It is, and it's another thing to really recognize that this is just the beginning, that this was in the field from March 15th to the 21st at the very front end of these layoffs. And the numbers, I mean, the headline is bad. 1 million jobs lost is 8 times worse than the worst jobs report we had ever seen. That was back in 2009. But then you start to get into the details and look at like how many people have lost a significant or a majority of the hours that they were working. Then you add in another 2.1 million Canadians. So all of a sudden you're looking at like 3 million Canadians that have either lost their job or the majority of hours they were working. And you look at who's being impacted, Rosie, and you and I have talked about this before, that, the majority of Canadians, 66% of us, make less than $46,000 a year. The most common jobs, you're looking at truck drivers and retail sales. Those lower income Canadians are getting the hardest hit. They're also, conversely, some of the ones that are out at the front end of doing a lot of the work, of bagging our groceries and working at the pharmacy and putting themselves on the line to provide the essential services that we all have. But the numbers are ugly, and this really does just set us up for an even uglier report in April. And then, I mean, the policy question in this is how long will this last? Even once they lift the lockdown, when are you going to go to a movie theater again? When are you going to get onto a plane and fly with all these people? How quickly are consumers going to get themselves back into the economy?
Lots of questions still. Peter, I'm going to leave you, if you don't mind, just because federal officials are starting their briefing. We'll, of course, hear more from Peter through the day as those staggering job numbers start to sink in already. So many of you already experiencing job losses. Let's take you now to the federal ministers and public health officials. This is the Deputy Prime Minister, Chrystia Freeland.
If you can, please use the wage subsidy in order to ensure that as many Canadians as possible can keep their jobs. We know that many Canadians are experiencing great difficulties because of COVID-19. Some are not covered by the wage subsidy or the CERB. We are working very hard to find ways to help them.
Today, Statistics Canada released its latest employment numbers. These figures represent more than 1 million Canadians and more than 1 million Canadian families who are experiencing great hardship and who are really afraid. To all of you, let me say, we're here for you. If you haven't already applied for the CERB, please do so. It is there for you. I would also like to urge all Canadian employers, if they can, to follow the example of those companies that have reviewed the wage subsidy commitment and have decided to hire back many people they had laid off. The wage subsidy will be retroactive. We are working very hard to get it through Parliament. If you can, please use the wage subsidy to be sure that as many Canadians as possible can keep their jobs. We also know that there are many Canadians in real trouble right now because of COVID-19. Some are not covered by the wage subsidy or by CERB. We are working hard to find ways to support you too. Okay, so today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, and Canada's Deputy Chief Public Health Officer, le Dr. Howard New.
Dr. Howard New, and then the President of Treasury Board, Jean-Yves Duclos.
Minister of Health, Patty Hajdu, is here to answer your questions too. Dr. Tam, please.
Hello, everyone. So I'll start, as usual, with an update on the numbers of COVID-19 cases in Canada. There are now 19,774 cases, including 461 deaths. Again, these numbers I know are changing as we speak, as provinces provide their updates. In terms of lab testing, we've now completed tests for over 373,000 people, with now over 5% confirmed positive, as Canada continues to improve testing to track where the disease is spreading. Of course, when I wrote the speech last night, I started the next paragraph with the weather warming. So anyone who's looked outside the window in Ottawa or looked at the weather forecast, that is not the case right now. But the holidays are almost upon us. And I want to reiterate how important it is for us to maintain our resolve to plank the curve. So far, the efforts of all Canadians are making a difference, from healthcare providers saving lives on the front lines, to public health and lab professionals testing and tracing COVID-19 spread, to essential service workers keeping our hospitals and our homes stocked, and every Canadian who's staying at home. I recognize that these changes in our daily lives that we are asking people to make are extremely difficult. Despite the hardships, we are all in this together. Canadians' collective effort to slow the spread has allowed our health system to cope, and that means we're protecting health services for everyone. So, during important religious observances, including Passover, Easter, Vaisakhi, and Ramadan, we need to not let down our guard. That means dinners and celebrations need to be strictly limited to your existing household members only. And as I've said, the safest plan for your holidays is a staycation for the nation. Make arrangements now for virtually connecting with others over phone, email, and video chat. We need to protect each other, and that is best done by keeping physically apart but virtually together. Connecting has never been so important, so please support each other. Thank you.
Et maintenant, je donne la parole au Dr. Howard New.
And now, Dr. New, you have the floor. Please go ahead. Thank you. Good afternoon. First of all, the number of cases of COVID-19 in Canada is now 19,417 cases in the country, including 461 deaths. For the lab testing, we've now completed tests for over 373,000 people, and now we're 5% of them confirmed positive. As Canada continues to improve testing to track where the disease is spreading. With the weather warming, even though it's actually snowing here in Ottawa, and the holidays are almost upon us, we wish to remind all of you how important it is for us to maintain our resolve and plank the curve. So far, the efforts of all Canadians are making a difference. From healthcare providers saving lives on the front lines, to public health and lab professionals, testing and tracing the virus. Workers are keeping our hospitals and homes stocked, and every Canadian who is staying at home, despite the hardships, we must continue We are all in this together. Canadians' collective effort to slow the spread of this virus has allowed our health system to cope. And that means we're protecting health services for everyone. That's why, even during important religious observances, including Passover, Easter, Vasaiki, and Ramadan, we must not let down our guard. That means dinners and celebrations need to be strictly limited to your existing household members only. During these few holidays, we must protect ourselves by staying home and only contacting people by phone, email, and video chat. We need to protect each other, and that is best done by keeping physically apart, but virtually together. Connecting has never been so important. We must support each other, and please do that. Thank you. Thank you, Dr. No. And now, I give the floor to the President of our Treasury Board, Jean-Yves Duclos. Please go ahead. Thank you, Christian. Hello, everyone. This morning, Prime Minister Trudeau gave us a message of hope and courage. And one of his messages mentioned the 102nd anniversary of the Vimy Ridge battle in 1918. This is a message that particularly resonates for people in Quebec because the Royal 22nd Canadian Regiment, which is an institution in Quebec that contributed significantly to that effort, that war effort. So we remember their commitment, their courage, the sacrifice that they made for our country. And I think that helps us and inspires and guides us in what we must do today. Secondly, I wanted to give you a quick update as to the applications we've received for the CERB. Yesterday, a total of 750,000 applications were made for the CERB benefit, which brings us up to over 5 million in all since March 15th. Of that 5 million, 4.6 million were already processed, which is excellent news for the millions of Canadians that find themselves experiencing hardship today and are feeling anxious and insecure. In closing, for those Canadians born in October, November, and December, today is the day that you should file your own application for the Canadian Emergency Relief Benefit. On Canada.ca/coronavirus. Thank you, Christian. Thank you, Jean-Yves. And now we're all here to answer your questions. Thank you. Today we will begin with 3 questions on the telephone.
Thank you. Merci. We will now take questions from the telephone lines. Nous prendrons maintenant les questions de ligne téléphonique. Our first question, notre première question, is from Lena Dibb avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est
Yes, good afternoon. My question is for you, Ms. Freeland. We now understand that it will be months before life returns to normal. The wage subsidy is for 3 months. Yesterday, we learned that Air Canada will also be benefiting from that, and that is definitely an industry that will not return to normal within 3 months. I was wondering if you were beginning to think about ways to distribute the money in a different way than just giving it to everyone who asks for it, given that not all industries find themselves in the same circumstances. Answer. As the Prime Minister said, and as Dr. Tam said, we do understand that the situation is going to be difficult for more than a month, more than 2 months. And we must be prepared. Also, as Dr. Tam said, we don't know exactly when the situation is going to come to an end and when it will be possible for Canadians to return to work. What the government has already done and what the government will continue to do is to be there for Canadians, for workers, and for businesses. We understand that this economic shock was not caused by economic processes themselves. It's an external shock, which is why It's a duty for the government to support Canadians and workers and businesses for as long as necessary. The good news is that our government and our economy, at the beginning of this crisis, were in very good shape. Canada and the federal government have the fiscal resources necessary to do all that is required to protect Canadians during this crisis. As for the length of time this will last, no one can say today how long these measures will be necessary to shore up our economy. The only thing we can tell you is that we are ready to do everything that's required. We have set up necessary measures today, and we did so very quickly. As Jean-Yves just said, the CERB, the emergency benefit, is there today, and it is already helping Canadians. We could not move as quickly with the wage subsidy. With respect to the future, the only thing I can tell you, but it's important, is that we will be prepared to support the Canadian economy. Thank you. Follow-up question, if I may ask you, the logic of long-term support offered to an airline industry that clearly will not recover over the next 3 months from this, wouldn't that money be of better use elsewhere? Answer. I think it's important for all of us to understand that no one can come up with certain predictions of the future. Dr. Tam was quite clear this morning when she explained the prognosis that we have when it comes to the progress of the coronavirus. Because of this great uncertainty, what we must do is precisely what we did do and are doing, which is providing the necessary support to our economy. And I would like to assure Canadians that we will continue to support our economy for as long as it's necessary to do so. It's very important for us not to let coronavirus damage our economy. We are taking the necessary steps now to protect Canadians' health and lives, but we know quite well that those necessary steps will have a serious economic impact as well. The government's work and duty is to protect the economy during that period. That is what we are doing now, and we shall continue to do so. We will protect Canada's economic capacity, and we must protect Canadians' lives. And that is what we will continue to do. I will close by saying that Canada and the federal government has the economic resources necessary to do so. Thank you, Madam Deputy Prime Minister. Next question on the phone.
Thank you. Merci. Our next question, notre prochaine question, is from Mia Rabson with the Canadian Press. Please go ahead. À vous la parole.
Hi, this is a question probably for Dr. Tam. Given the modeling that you released this morning and sort of maybe the better understanding of how you see COVID-19 unfolding in Canada, are you recommending that governments enact stricter measures for things like physical distancing in businesses? And if so, what additional measures do you think should be considered?
Yes, so we do have to sort of monitor the trajectory very closely on a daily basis. I think together with the other chief medical officers, we recognize that we need to try and ascertain how do we measure the effectiveness of our public health measures. Some of these studies might be quite innovative. For example, just tracking mobility of the population, and some of these kind of data people have seen sort of being published as we speak. And that tells us a little bit more about how well Canadians are doing with some of these recommendations and where we can strengthen those recommendations. I think we know that some areas of social distancing has really been reduced in terms of no one is gathering, really. We're trying to strengthen. There's certainly no mass gathering of any size. We're just trying to strengthen the message to Canadians that really you should avoid all non-essential travel and stay at home as much as possible during this critical period. I think that behavioral scientists are studying these kind of phenomena as well. And how do you nudge people to sort of do better from that perspective? We know that contact tracing is very key to make sure that we stay on the trajectory and, if necessarily, improve. I think yesterday I talked about the fact that you can, on the one hand, really try and support people in self-isolation and in quarantine, making sure they have the right environment to do so safely. And if they don't have the conditions at home to do that, to support them, maybe housing in a different space. I think but on the other hand, you've seen jurisdictions come with more measures on the compliance and enforcement side to try and ensure that all Canadians know how serious this situation is and that we want them to take things seriously. So tightening up on making sure people who are sick stay at home and that any close contacts also self-isolate is really, really important. So I can't stress that enough. And as I've said, we do continually have to improve on laboratory testing capacity. That helps you detect the cases, which is absolutely important to maintain this trajectory and put this epidemic to a first wave to a close. So it's not any really different to what we've been recommending all along. But we would, at some point, I think as we are coming down the other side of the epidemic curve, we would like to look at different ways at which we can measure the impact and success, both positive and also negative impacts of our measures as well, so that we can recalibrate as we sort of move ahead. But for sure, case detection, contact tracing, and social distancing still remain key.
Thank you, Doctor. Mia, follow-up?
Yeah, I'm just wondering, there's a lot of Canadians, I think, watching
Bon nombre de
the United
Canadiens
States and some of the
suivent ce
scenarios
qui se
going on
passe aux
there with a bit of
États-Unis avec les
alarm.
différents scénarios
I'm wondering
inquiétants.
how dependent is our best case scenario modeling on border measures and how the United States does, since it does seem like their situation is more dire?
Well, we say that even within Canada, we have significant regional differences. So we are different from what's happening in the United States in terms of their epidemiology. And we want to be able to stay in that epidemic control curve that I presented today. So we'll be doing everything that we can. I think the measures that we've put in place, and the ministers may want to comment on that too, is really restricting travel to essential travel, ensuring that those essential services continue, but really cutting down on the amount of travel between the two countries to those essential travel will remain very key. And again, we can't adjust any of that until we've seen not just what happens within the Canadian context, but definitely what's happening on the other side of the border.
And I'll just add, Mia, that today was our weekly call with my counterparts at the G7. The health ministers meet every week to talk about the scenario in our various countries and what's been working and the struggles that we are having collectively as countries. And one thing that was acknowledged, I think, by all partners was that there needs to be a global effort to eliminate COVID-19, that this can't be, Canada's problem will not be resolved until all countries have strong measures, both on the suppression of COVID-19, but also on the long-term treatment and prevention of COVID-19 in all of our populations. And that was recognized by all health ministers in that call.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Notre prochaine question, our next question is from Hélène Buzetti avec Le Devoir. Please go ahead. À vous la parole.
Good afternoon. I would like to come back to the scenarios that were presented to us this morning. It's not clear in my mind exactly what, in your minds, is the most probable scenario. Your charts seem to show 2.5 to 5% infection for a number of deaths going to between 11 and 22,000, but there's also a 10% rate that produced 44,000 deaths that mentioned by Mr. Trudeau this morning. I understand that you don't have a crystal ball, but in your opinion, what is the most probable projection? Thank you for the question. This is Dr. New. As we said this morning, we are continuing, all Canadians, all levels of government, all our healthcare systems, public health care organizations are continuing all efforts to flatten the curve. So that means that we expect to continue to see in the future a 1 percentage rate of infection in the whole population. Now, that's 1% of the entire Canadian population. It's not over 1 month, it's over several months, perhaps a year or more even. So if one calculates that over a population of 37 million people, we expect to see about 376,000 cases. But that's not the only concern. We must also we must remember that we're just at the beginning of the epidemic here. We need to watch how the epidemic is moving in all areas of the country, in all the provinces and territories. So it's difficult to forecast exactly when we're going to arrive at the peak of the wave. Right now, we're just at the beginning of it. And we won't know we've arrived at the peak until we're already starting to go down. So everyone's priority now is really deploying all efforts at physical distancing, and we will see from 1 week to the next what happens.
Going back, sorry. In terms of where we're at, certainly from all of the best efforts, all Canadians, including all levels of government and also obviously the public health and healthcare system, we're looking at what we call a hopefully best case scenario, 1% sort of attack rate in the whole Canadian population. If you do the simple arithmetic, looking at the Canadian population of about 37 plus million, obviously that would translate to about 376,000 cases. But those 376,000 cases, we certainly don't expect it to happen overnight. We expect it to happen over many months, even a year or so. Look at where we're at today. We're about to, 20,000 cases now. So we still have a ways to go. Having said that, it's also difficult to predict exactly when we'll get to our peak, because you won't know when you're at the peak till you're actually on the other side of the sort of downward curve. So it remains to be seen what happens over the coming weeks and months. But for the moment, in terms of what we're doing, I think we can't let go of our public health measures. Everyone is doing their best in terms of physical distancing. And I think we just have to watch week by week how we're doing as a country.
And as a follow-up, maybe I can ask Dr. Tam, it's not clear to me, so should I understand from what's being said that the 1% scenario is the one we are working on right now if everything remains the same? I understand we can't predict the future, but right now you're saying that the most probable scenario is the 1% one?
I wouldn't say the most probable because we don't know that yet. I would say that's the aspirational and our ambitious goal that we, provided in terms of the briefing today. And everything that we can do now will reduce that infectious rate and in as short a time as possible. So we called it our ambition because we will have to check to see exactly how much of the population is infected. Some of that kind of work, as we work through this first wave, would include, right now we're looking at what kind of serologic tests are available, for instance, that will help us determine how much of the population in the end of that first wave has actually been infected. So these are some of the data that still needs to be gathered.
Thank you, Doctor. We'll now turn to the room. Start with Mary Kay Walsh from the Globe and Mail.
Hi there. Still on the modeling, could you, we spoke with one academic who said that your models appear overly optimistic, that, for example, your best case scenario curve does not show the subsequent curves, and that it therefore it might even be faulty, because if we do have everybody on lockdown, unless they leave lockdown with a vaccine, there will be more spikes.
So this is a novel virus for which the population is not immune. So it's true that if after the first wave, and we did really, really well, only a small proportion of the population is in fact have encountered this virus as immune, we are in for a significant period of time where we would expect that public health measures to some extent will still be applied. It'll be, to me, a sort of new normal. We have to be really careful how to release some of those public health measures because the population is not immune. So we've seen a little diagram where there are little blips after the first big wave. I think these are scenario planning. What we want to do is to make sure that any subsequent wave is dealt with really rapidly and it stays below the capacity of the health system to be able to cope. So that's the concept of those scenarios. But those little waves could continue to occur for a number of months until either, say, a vaccine is discovered or then the majority of the population is immune in some way. But we can't go too far into the distant future in estimations because the virus could change. We don't even know if you are immune today, how long that immunity will last for. So by all means, we're not saying these scenarios exactly what's going to happen. This is an estimate, and these can be adjusted. But whoever that person is entirely correct. We have a long ways to go in the whole trajectory of this pandemic.
Okay, thank you. And Minister Hajdu, on my colleagues' reporting this morning on sort of the 2006 pandemic report and what it foretold and what we're now experiencing, I'm wondering if you regret that Canada was not better prepared, that Canada did not have what appear to be sufficient stockpiles, for example, in the emergency stockpile, and that things like widespread testing were not put into place early enough.
Well, I'll answer generally, and then I'll actually turn to Dr. Tam. But first of all, I want to thank the excellent leadership of our public health officials who have been guiding us through this since the emergence of this brand new virus at the end of December, early January. Obviously, Dr. Tam used the pandemic plan as a guidance document to stand up the organizations that led to, for example, the public health officials from all across the province and territories meeting on a regular basis very early on. In terms of the national stockpile, of course, always more could be done to prepare in terms of pandemics. I will also remind you that provinces and territories have stockpiles. And of course, the work that we're doing collaboratively right now on ensuring that frontline healthcare workers have what they need is critically important. I will also say that in terms of anticipating the behavior of the virus, I think Dr. Tam has repeated this a number of times. and I think it bears repeating, this is a brand new virus. So even if we had testing capacity, so to speak, what kind of test? What did that look like? Those were all things that had to be essentially developed once we were able to receive the genetic sequence from China in those early days. And so I just want to, again, reiterate my thanks for the leadership of the phenomenal public health officials that have guided us through this. Certainly, we're grateful for their expertise and their involvement in determining our response. Did you want to speak a bit about the early testing and the challenges around that?
So I think Canada is a country that have done pandemic planning for longer than almost any other country in the world, and we have a strong history of doing that. That particular plan, 2006, came out just after SARS. We actually experienced another pandemic even after that, 2009. That led to essentially an evergreen plan, which you will be able to find on our website. And the lessons learned from 2009 is to be able to flexibly and scalably mount a response. You can't tell what the next pandemic might be like. So it's the flexibility in the system and taking a risk management approach. Instead of those specific phases that we had in 2006, we moved on to a much more flexible response. And based on my experience, as I've always said, when you've seen one pandemic, you've seen one pandemic. You cannot anticipate what that next. In fact, the best thing to do is throw out all the previous assumptions because they're likely to be wrong. We do have much better tools than before. Those genetic sequencing done in breakneck time, quite frankly, has allowed Canada to develop our PCR test really, really fast. I'm actually quite happy with the fact that there's a network of public health labs. We decentralized. Unlike some countries, we decentralized the test pretty fast. Quality assured, the provincial labs all picking up their ability to do so, and then now distributing the laboratory capacity down the line as well. And we are pursuing other tests. So I would essentially put it to all Canadians that we were one of the fastest countries in the world to establish good laboratory capacity. Could we do more? Sure. I'd just like to explain the NES, the National Emergency Stockpile, Strategic Stockpile, just a little bit. As we all know, the healthcare system is in the jurisdiction of provinces and territories, and they do have supply management. They use a lot of resources on a daily basis. At the federal level, we are much more strategic in what we have in that stockpile, and that's deliberate. We moved from the sort of Cold War model of what the National Emergency Stockpile looked like at the time to one that's highly specialized. In it, it's the country's only stockpile of certain specific countermeasures, like the smallpox vaccine, like the Ebola countermeasures, which no one else actually has. That's the role of the federal stockpile. We have some other smaller surge capacities, but it was never designed to back up the whole health system in Canada. What we do, though, is together with other government departments, put together the coordination mechanisms needed to pull together that infrastructure. We had a massive role in pandemic vaccine infrastructure building and putting it one of the world's first pandemic influenza vaccine contracts in the world. And we are striving to be as early as possible in a global leader in vaccine development and also ensuring that we look ahead to that day when we do have vaccine candidates, that we're in the best position for that. So that's some of the roles that we're doing. And you've seen multiple whole of government response looking to get any supply that we can. We're in a global global supply shortage situation for almost everything that we need. So I can certainly attest to the fact that everybody is pulling out all stops. And that is part of our role, is not to just stockpile stuff in a lot of places, but pull together the mechanisms so that there's access.
Thank you, Dr. McKenzie.
Hi, Mackenzie Gray from CTV. Dr. Tam, got a question for you and Ms. Freeland as well as a part of this. On March 21st, we closed the border effectively for the entire world. We stopped the U.S. Citizens from coming in that day. Dr. Tam, when the models that we've seen today, how much did closing the border impact our ability to plank the curve, as you like to say? And Ms. Freeland, on this same issue, the Prime Minister has said essentially that we won't see normalcy in our lives until there is a vaccine. So can we conclude from that the border will not be reopened until we have a vaccine?
So, I well recall that particular week in March where almost everything happened, not just some of the border measures that the federal government played a key role in, and some of the travel advisories, but also everything else like reducing mass gatherings. Much has been done by the province and territories within about that same time frame, which is why we're saying that these coming weeks are critical, because we systematically escalated all of those measures around that time period. So teasing out the exact contribution of every single one of those components may not be the easiest. What I will say is the whole world global traffic also went down at the same time. And we do know that if we looked at our cases, the contribution of travelers as being cases diminished over time.
So the Prime Minister did indeed explain, as Dr. Tam has done, that we need a vaccine to really be through this. In terms of what that reality means about the border, we just can't say today. And it would be foolhardy in the extreme to make long-term predictions about what border measures will be. Having said that, as you know, we have taken really meaningful measures at the border, including the land border with the United States. We have introduced mandatory quarantine for everyone coming into Canada wherever they begin their journey. And we have been introducing increasingly effective ways of enforcing that quarantine. All of those measures are really necessary, and they are helping us to protect the health and safety of Canadians.
And if I just might add, I think this is a question that all countries are facing right now as they try to contain their own community transmission and their cases go down. The question becomes, how will they manage then the importation of questions? And I would echo Minister Freeland and Dr. Tam that is unknown as of yet. But I will tell you that we are studying those countries that are ahead of us on the curve, that are on the downward slope, if you will, and looking how they contain those bumps of transmission very carefully so that we can learn from their experiences. And certainly, if there's any silver lining, it's that we are earlier on our journey in terms of the rise in the curve, that we're able to look at the experiences of other countries that have experienced that peak more recently than us.
Dr. Tam, everyone is in agreement, and we've brought this up a number of times in questions to you, that testing is a core component of being able to figure this out. We've spoken to a number of people who have spoken to their doctor, and they've said, okay, you should get tested for COVID, you're showing symptoms. They go to the testing facility and they say, we're not going to test you. At this point in time, are you considering making any changes to the restrictions in place for people when it comes to testing in Canada? And the modeling today has shown, and both Dr. New and you have spoken about this, that there will be multiple waves. How are we going to get these multiple waves under control if we don't expand the testing criteria that we have to include everyone who shows symptoms?
So we are improving our laboratory capacity, and I think that is ongoing at multiple fronts. And I think I've explained it in the last days, where we're trying to improve on the volume and the capacity for the PCR testing. There's a need to get the reagents and other components of that. And we're trying, again, it's like any supply, every way possible, including domestic, domestic concoctions, if you like, of the said reagents and all of that, so that we can improve capacity. And we are testing a significant number of people. and have maintained a good rate of testing compared to many countries in the world. But we will continue to do that and look at point-of-care testing as well as the serologic testing in the future. What I will say is that when we provide guidance in terms of where the priority focus might be, and the people who absolutely have to be tested, including healthcare workers, the vulnerable population, etc. At the moment, our public health measures are such that mildly sick people we're advising to stay at home. And some of them are not being tested because we are focusing on priority groups. As the laboratory capacity changes and different kind of tests come on board, and we're in a different trajectory in the epidemic, then we have to increase testing as we come down the pandemic and trying to detect the next incursion. That's when we would have to test more widely again. So it is a very dynamic process, but we still expect our recommendations, and this is a behavior change for Canadians. If you're sick, stay home. The key is the public health action on breaking change of transmission, whether you've had the test or not. I do think that there is a role for, of course, serology to determine the basic immunity level in the population. There's a role potentially to look at how immunity works, particularly in groups that are vulnerable or groups that are delivering essential services. So those are some of the priorities going forwards. And so I think, we will evaluate that as we go along, but absolutely upping our lab testing capability is what all provinces and territories and us are trying to do right now.
Thank you, Dr. Mora. Politico.
Yes, thank you, Maura Forrest, Politico. This is, I think, for anyone who wants to answer it, but Canadians got a lot of pretty bleak information today, both in terms of job numbers and in terms of the projections of infections and fatalities. And aside from the information, there's still a lot of uncertainty, a lot of questions that haven't been answered about when we might be on the other side of this. They're now heading into a holiday weekend where they're being asked to stay away from their families. And I just wonder how you think Canadians should react to this. How should they absorb this information and deal with it?
Well, first of all, I would just say that I understand that there's a lot of fear and there's a lot of distress and there's a lot of anxiety. And, I would say that all of us are feeling that with Canadians. I think this is a time where the uncertainty itself is, difficult to manage. Just the questions that we are receiving from all of you, essentially, when will this be over, I think is the pressing question that most Canadians have. When will this be over? As I've said, this is a time for us to pull together as Canadians. And I know that that fear is real, but it will take the courage of all of us to maintain the practices that public health has prescribed us, if you will, to end this situation earlier, to protect the health and the lives of our loved ones and our friends. And there are ways, personally, I think, that we can feel better. And for me, one of the ways that I feel better is when I do things for other people. Many people have reached out to me, by the way, and I thank all Canadians who have sent messages of encouragement and of positivity. But we can all do that in our lives to the people that are lonely and that are isolated. We can all send notes. We can all call those people that we know are struggling, or maybe even those that we're not thinking are struggling, to say that we're thinking of them. There are multiple ways to connect with people that aren't physical. And people are craving connection right now. They are craving connection with friends and with family. And I would say that it's important that we all reach out to the people in our lives. We can also help those people that are left behind. There are a whole bunch of people that are left behind. There are people that have no one and have no one to get groceries for them and have no one to actually check in on them. And it's, I think, the most Canadian thing that we could do is to remember all those people in our lives, and even those people that are not directly in our lives, that have been left behind in all of this, that are even more fragile and even more vulnerable. It might be the little old lady next door to you that has a really hard time getting around, that doesn't have anyone in their life. It might be the child on the road that looks at you beseechingly as you're walking your dog. People are saying hi way more than they ever did, and it's a genuine hi. It's a genuine hello. We can donate to charities if we have a little bit left over. We can see if our food bank needs a volunteer or two to help distribute food. And I think through the act of giving, through the act of reaching out, actually it makes us all feel better. And I realize this is not the simplest answer, but it certainly is one that I think for me has helped a lot. That when I step out of my own anxiety and my own worries and my own direct kind of world and I reach out to other people, it makes me feel better too. And so I think together, this is what we mean when we say together, Canadians will get through this.
And I just want to add one thing, Mara. You suggested that the data released today would make people feel frightened. And I think that's right. But what I would also like to say is information is power, and facts are powerful. And what we have had over the past 10 days or so is a tremendous sharing of information by governments across Canada, starting with the provinces that have been doing a terrific job of sharing really detailed data with the people in their provinces, and then with Dr. Tam and Dr. New sharing a sort of federal roll-up. And I would really encourage Canadians to feel informed and empowered by that data, because what that data says to me is we need to do what we are doing, and that while the physical distancing actions that we are all taking in our daily lives are hard, for sure they're hard, and it is hard to practice physical distancing, and it's really hard to lose your job because of it. Terrible. Having said that, to me, what the numbers show, what the data shows, is we're on the right track, and it is in our power, as Dr. Tam just said, to achieve that ambitious, aspirational target. We can all do it. We are all a part of it. So turn that very understandable, legitimate fear into power and a conviction that we all need to do this hard thing to get the best possible outcome for Canadians.
Thank you. And a follow-up from Minister Hajdu. There's been some debate about the possibility of virtual sittings of Parliament, and how important it is for Parliament to still convene in person. I wonder, do you believe that it's safe for Parliament to still sit in person with a reduced number of MPs?
I know the House Leader and the various folks that have their mind turned to this would only suggest convening in person with appropriate measures in place to protect the health and safety of all parliamentarians. As you can see, I'm in Ottawa every day. I want to thank all the cleaners who prepare this room for us every single day, and in between, there are measures that we can take in terms of sitting distantly from one another that would be applied, and certainly, if that decision is taken that we need to meet in person, I will count on all of the professionals in our lives who are working so hard to keep us safe as we have to physically attend our work sites.
Thank you, Minister. Operator will now turn to the phone for two more questions. Deux dernières questions avant de mettre fin à la conférence.
Two last questions before ending the press conference.
Our next question, notre prochaine question, is from Michel Lamarche avec TVA Nouvelles. Please go ahead. Your line is now open.
Good afternoon. This question is for Dr. New. I would like to ask you about the percentages that we saw this morning about the infection rates in the population. Since the beginning of these press conferences, you have been telling us about a 5% rate of infection among those being tested across the country. Does that not suggest that the 1% infection rate scenario, or the 2.5% of the population being infected, are the most realistic scenarios? Thank you for the question. We said several times that the results of laboratory tests are always underestimating reality, because not everyone is getting sick, and not everyone who is exposed becomes infected. And so that's why we talk about a 5% infection rate. But we do know that many, many more people are infected or were infected, and we're unaware of that right now. In the future, we expect to develop further laboratory tests called serological tests to be able to better estimate the percentage of the population that became infected. And that will show up because they will have an immune response in the form of antibodies. And the serology tests show that. So if we continue our best efforts in flattening the curve, I do think we have a good chance of achieving a better scenario, the best scenario of 1% rate of infection within the population. However, it's too soon to know exactly what's going to take place. And I know that all provinces and territories are pursuing their best efforts to increase their laboratory testing capacity and are trying to test everyone who needs it as much as they can. We also know that the tests use genetic sequencing, and I know that all provinces and territories are increasing their capacity for that type of technology. However, we are also enhancing our toolkits with further testing, including serological testing, serology testing. And eventually, we will be able to test the entire population, we hope. This is something that is evolving from day to day and from week to week. I have a follow-up question, Dr. New. I'd like to hear what you have to say about private residences, about nursing homes, about long-term care homes. We've been saying since the beginning that the hospitals are coping so far across the country. However, we do realize that in long-term care residences, in nursing homes and such places, things are much less well managed. Are there measures, and now I'm asking you for a specific and concrete answer, please, are there measures that you yourself can implement to help provinces immediately help all those places function better as of now? Answer, thank you for the question. Yes. We do know that in some environments with some of the most vulnerable populations, like the elderly, as you said, in institutions of long-term health care and that type of establishment, we realize that it is more difficult in such establishments to use the necessary measures. It may be possible that there aren't many private rooms, for example, in some of these institutions. Now it's at the local, provincial, territorial levels. Those are the authorities who are managing how things work in these institutions and measures taken by long-term health care establishments, for example. What we're doing currently, Dr. Tam, myself, and all the other chief medical officers, an issue that we are all discussing ourselves are guidelines and directives for long-term health, for long-term care institutions. We also want to help them better manage these situations in the future. We do know that it is a priority issue for everyone. One last question, operator.
Thank you. Merci. Notre dernière question, our last question, is from Micheline Laflamme avec Radio-Canada. Please go ahead. À vous la parole.
Thank you very much. Hello, everyone. This morning, you told us about your data, your modeling. You talked about infection rates, mortality rates. You also talked about the number of people in intensive care. But there were also data about the number of sick people who will require ventilators. You surely have an idea of how many ventilators there are in the country right now. So, from what percentage of an infected population population will our health, at what percentage rate will our healthcare become overwhelmed? Dr. New is answering the question. Thank you for the question. It is difficult to estimate, but if we look at the worst case scenario in which everyone who needs intensive care may be a candidate to require a ventilator, we have calculated that, and we know we have more or less a sense of the number of ventilators that we currently have across the country. But as we said several times, it's not just about the number of people who may require ventilation, but it's also about the time frame. In a population, there may be 1,000 people, let's say, and if all 1,000 of those vulnerable people fall ill, they may require intensive care and perhaps also a ventilator. But if we manage to flatten the curve, and of the 1,000 people in that population that require intensive care and or a ventilator, it makes quite a difference because the healthcare system won't be overwhelmed. If 1,000 people all fall ill in the same week, or if it happens over several months, then the healthcare system can accommodate them and look after all the patients. Micheline, do you have a follow-up question? Thank you. To better control the spread of the disease, BC and Alberta announced this week new strategies to ensure that those coming into the province comply with self-isolation orders and reduce the risk of the spread. So to better contain this virus, and perhaps during following waves, will geolocation or BC's proposal of
Madame Freeland, qui pourrait être encouragée à travers le pays ou que vous pourriez adopter?
Nous avons travaillé en étroite collaboration avec la Colombie-Britannique concernant
British Columbia with respect to new measures that were announced, the new measures they announced yesterday. And we are working with all other provinces and territories as well in order to implement such measures. Each province has its own specific characteristics, but we strongly support what BC has done in close collaboration with us, and we are absolutely ready, and not only ready, but today and yesterday and the day before yesterday, we're firmly committed to working with all provinces and territories on that issue.
Minister, that's all the time we have today. Ceci met fin à la conférence de presse. Merci.
This brings the press conference to an end. Thank you.
Okay, and that is the end of a federal briefing from cabinet ministers and federal public health officials. Really the highlight today, some of that national modeling giving us a picture of how long this might last and how much, how many people could potentially die if we don't keep these strict public health measures in place. They are now saying the first wave of COVID-19 could go until the summer. The Prime Minister giving that stark warning that we will have to be vigilant and continue some of these measures until there is a vaccine. On that note, we will go live to Quebec City now, one of the 4 provinces with the most cases and deaths. The Premier and provincial officials are providing an update on the coronavirus. 891 new cases in that province today. I'm Rosemary Barton. I'll hand things off right now. I'll see you back here tomorrow.
We're between 60 and 69 years of age. So that means that 99% of those deaths are people of 60 years of age and over. So that does mean, on the one hand, that it's reassuring for the younger people, but obviously it also shows us where we have to put our attention.